I'm a high-risk labor and delivery nurse. Here's what that first night with your baby typically looks like after you give birth in a hospital. Most hospitals have a separate unit after you give birth called the postpartum unit or the mother-baby unit, which means after you are recovered and stable, baby is safe, and you will actually change rooms from the labor and delivery room to your mother-baby room. We will help you pack things up. We'll transfer, move all the things over. Then we get to the postpartum unit. It's possible you will have a different nurse. Your labor and delivery nurse is going to pass over your care to the postpartum nurse, and we start leading into the night, and it can be a little strange. You'll meet your night nurse. She may want to check your bleeding too and get a set of vitals. You might get a dose of Tylenol or ibuprofen or any other medications that you agree to. Eventually, it will just be you, your partner, your baby. If you're feeling up for it and it's safe, you'll be getting up, using the bathroom, clean your bottom up, change your pad out. And you might need help doing these things. You might want to get ready for bed. You may take a shower, get pajamas on if you brought pajamas, and there in the bassinet will be your baby. Where I work, the bathroom is in the same room. Baby is right there in a rolling bassinet, just a few feet away. After you start winding yourself down, but a lot of people find that they have an adrenaline kick that first night after giving birth. You may have trouble falling asleep. And while that's going on with you, it's very likely that your baby will be pretty sleepy and drowsy and taking their newborn nap, as I like to call it. Labor is really tiring, not just for you, but for your baby. Surgery, if you had a C-section, is really tiring. Baby transitioning into a completely new universe to them, very tiring. Most babies get really drowsy that first 24 hours. If you fall asleep, that's amazing, and the staff may or may not be popping in and out of your room. And side note, you are welcome to request staff do not come into your room very much, as long as you guys are safe and stable. Eventually, baby will wake up, cry, be hungry, probably going to be checking your baby's diaper. First 24 hours of life, we expect at least one pee and one poop. Anything else is a bonus. Then you can breastfeed your baby or bottle feed your baby, whatever feeding choices you have made. If you need assistance with breastfeeding or pumping or formula feeding, call out to the staff. In most cases, once baby is well fed, they usually drift off, get pretty drowsy again, and head back to sleep. You might hear activity outside of the door, staff at the nurse's station. I hope not, but it's definitely possible. There may be beeping IV poles, and your baby also is pretty noisy. Coos and gurgles and baby noises. It can be hard to rest and settle and shut your brain off. If you're breastfeeding, you're probably going to be pretty hungry. So I always packed a lot of high protein snacks in my hospital bag, and a lot of hospitals do have snacks. Also likely that they will weigh your baby at some point overnight. It's common for babies to lose a little bit of weight the first few days after birth, so they're just monitoring to make sure that this is a normal amount of weight loss and nothing excessive. That first night, it may feel very overwhelming. There was a lot of activity, a lot of excitement during the birth, and now it's just you and your baby, and that can be scary or exciting or overwhelming. You may feel joy and elation, or you may not feel immediately bonded to your baby. You may not have an immediate connection. That's actually can be normal. You might also feel like you have no idea what you're doing, and that's completely fine. Ask for help from your partner, from your staff. And this will definitely vary from one place to the next and one situation to the next. This is typically what we see with our patients that first night and what happened with me and my 3 babies that first night. So I hope this helps, and follow for more.